Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us for the segment, we have John Kao, CEO of Nasdaq-listed Alignment Healthcare, to discuss the Medicaid space and how the company has evolved as it celebrates its 1 year being listed on Nasdaq. John, it's great to see you again. Welcome back to Trade Talks.
Hi, Jill. Thanks for having me back.
You got it. And give the audience a reminder of what Alignment Healthcare is all about.
Alignment Healthcare is a nationally traded public company focused on Medicare Advantage, which is serving seniors who are 65 and above. And we provide the insurance and the care for them.
Alignment Healthcare recently marked 1 year of being publicly listed, and the market has certainly changed pretty dramatically. How has your team adapted? And can you talk to us the past year and what you've experienced in the Medicare space?
I tell you what, it's been a fantastic year. We have beat and raised every quarter since we went public. We're focused on long-term value creation, and we just keep executing. And I really think that the key thing here is to just keep your eye on serving the senior. If we do that, good things are going to happen to the stock price. And the values of the company is real simple. Hard to do, and not many of our competitors do it. Just take care of the senior as if it's your mom or your dad. That's it. Just take care of the senior. If you want your mom and your dad to be taken care of, that's it. Number two, take care of the doctor. Support the doctor. Make sure they have all the tools and information they need to take care of the senior. Number three, we use a lot of data, a lot of analytics to make sure people are making the right decision. And fourth, and I think most importantly, have a serving heart. Like, you would want your insurance company and healthcare providers just to make sure that they have a serving heart, that they care. So those are the four things I think we keep our eye on. And the stock's going to take care of itself if we focus on execution and delivering value to the seniors.
John, can you provide any insights on the big picture for the Medicare space?
Sure. So just to put a couple of statistics out there, there are 64 million people that are 65 years and older right now. That's going to grow to 80 million in the next 8 years. Think about that, 80 million seniors. And also, Medicare Advantage is going to grow from about 40% market penetration into about 50% or 51% over that same period. And so the need for serving these seniors is huge. It's $1 trillion a year total addressable market. Okay, growing inherently by 8 to 9% per year. And so people are going to need solutions to solve for this collision course, if you will, between this growth of seniors and kind of the shortfall that you see happening in hospitals and providers. There's a shortfall of clinicians. So how do you deal with that? That's the big question that we're trying to solve for this country. And I think one of the most important things. And again, we started the company because of my mom. Mm-hmm. She had a heart attack, and I go, there's got to be a better way. And so that's how we're doing this.
And you had mentioned the performance quarter over quarter. What were some of the key takeaways from your most recent earnings?
Executing against the investment thesis, which starts with know who the 20% of your population is that account for 80% of the spend. Those people are the frail, the vulnerable, the polychronic. And so we pride ourselves in taking care of the people that need the most care. And so if you do that, and those 20% account for 80% of the spend, right? So it stands to reason, if you can take care of the people that need it, you're going to drive down costs. And then you take the cost savings and you reinvest that into better, richer coverages and better social health care for these seniors through social determinants like groceries, like pet sitting. I know it sounds crazy, but pet sitting, right? Pets are important to seniors. It addresses loneliness and mental health. Transportation, simple things like that are important to seniors. So it drives more coverage, which is why we're growing. But the key to the whole thing is something in our market that's called the kind of medical benefit ratio. How much of your benefits and what's your cost structure look like? And this whole notion is take care of the people that need it the most do well by doing good. Just do well by doing good. Treat everybody like your mom or your dad, drive down costs, reinvest richer benefits for everybody. And so you get this virtual flywheel effect, which is what we're doing.
Yeah, and it sounds like that really is the key differentiator between Alignment and your competitors. And you said it, at the top and just now, treat them like your mom and dad. It just seems so obvious, but
It's
yet
so
your competitors
obvious.
aren't doing it.
The number one question I get, Jill, is like, John, what you're saying is so obvious. Why isn't anybody doing it? And so that's why we started the company. Just treat people like your mom or dad, take care of the doctor, use a lot of the right data and simplify the whole complex healthcare environment, make it simple for everybody, and just care.
Right.
Have a serving heart. It seems so obvious, but naming somebody else that thinks like that, there's not a lot.
Right.
So.
Right. I feel like everyone is so focused on leveraging that data. And of course, data is necessary to provide more tailored services. But at the end of the day, this data are people, right? And, I feel like a lot of companies are losing sight of that.
Well, and let me ask you, would you want your mom or your dad to have their healthcare solved by an application? No, you want a nurse, you want a doctor, you want a care team taking care of them. You want the data to enable them to make better decisions, right? So we need the data, but it's still healthcare. You need people taking care of people, having them have the most informed experience. And that's what I want for my mom. And I want to make sure every single senior in this country has the same experience that my family has. I'm not even kidding. That's the transformative nature. That's what makes this so important. It's just so important that this whole generation that's growing into seniors just have a better experience. That's what differentiates us. And so it's a combination of the data, the care delivery, chronic disease management model, really good competency expertise of understanding what people want. And you know what's even more obvious, Joe? Listening to them. Right? You just listen. Like, what do you want? Like during the COVID, let me just 2 seconds. During COVID, last couple of years, we had a lot of virtual town halls with our members, and they said, okay, we get the fact we need to shelter from home. This is 2 years ago, right? And they would say, yeah, but that's great, John, but we can't eat if we can't go out. How do we get food? Right? So we listened to them. And we partnered with a local Meals on Wheels, which is a local vendor that delivers food for people. We bought it, basically, and delivered 60,000 meals for people. Just bought it and gave it to them. Then they said, okay, we get the mask thing. Okay, but John, remember that's 2 years ago. We can't get any masks. You can't get any masks, remember? And so we went out and we manufactured 100,000 masks. And then we mailed them out to everybody. And for those that we couldn't get to, I got my, I think she was 16 at the time, 16-year-old daughter. And we drove around the local market here in some of the more underserved markets. And we're delivering masks to people, knocking on doors. And I go, who the heck are you? And we said, well, we're from Alignment Healthcare, and we're here to deliver your mask. You've requested 2, and we couldn't get it mailed to you because for whatever reason, we couldn't get there. And it was an address that was, it was like an address, like 225, whatever lane. And it was space 6. And you go, well, what does that mean? It's a mobile home. Right. It's a whole world of seniors that we're trying to take care of that currently don't get the right amount of care they deserve.
Yeah, it's so interesting, John. Simple actions like that to me is almost just as rewarding as having a great quarter. It's such a simple action, and you could have changed someone's life, even just that interactivity that seems
one person
so bad.
One person, if we could save, let alone hundreds of thousands and millions, right? That's why this is so important for this country.
So, John, as we look beyond the pandemic, hopefully, what does the future of Alignment Healthcare look like?
Literally creating a flywheel in every single market in this country so every single senior can experience a better, more secure, healthcare system with the insurance to ensure that they have the funding, making sure they have the right coverage, making sure that they have the right supplemental benefits to deal with their social determinants. And that's a fancy way of saying making sure they live a happy life. They get food, they get companionship, they have mental health support, and just basic stuff, and to have what we would call peace of mind that somebody's out there that's their advocate. I mean, it's like I feel that for my own, I can't tell you the peace of mind I have. Just like somebody cares and is looking out for my mom,
Yeah.
And then my mom goes, oh, she goes, okay, go take the garbage out, and okay, but your alignment, it's pretty good. Like it's from my mom. It's like, okay, that's like the ultimate compliment.
Well, and John, I mean, you know this better than anyone else. Advocacy is so important, especially for seniors. And as data and the technology with their medical devices and medicine changes, that advocacy is so important. But I do want to ask you, in our last minute here, on a personal note, May marks Asian American Pacific Heritage Month. What does this month mean for you?
It means everything. My mom, my dad, God rest his soul, they were such an influence on me. But really, when I was growing up, there was nobody really in healthcare that was Asian American that I could look up to. And so they really were my bedrock and formed a lot of my values. I would also say that in today's environment, health equity is so important. Making sure everybody has access to quality care. And obviously we're focusing on seniors, and there's a lot of the stuff that you read in the press around how Asian American seniors are being attacked. Mm-hmm. That's not okay, and so we're working on things that, like, how can we make sure they have even security and protection are things that we're thinking about. But I think that Asian Americans have come a long way. There's a lot of great leaders now in multiple different kinds of sectors. I'm committed to ensure that my daughters, one is at Northwestern, the other one at UCLA, are going to have the next generation of not having to worry about this stuff. Mm-hmm. And I don't consider myself a role model or anything, but I think I am. I say that with a lot of humility. But it's important that our next generation has all the tools and accessibility to even do greater things for us, for this country.
Well, you're doing something right. You have 2 kids and 2 great schools, so you're doing something right there, John. Great to see you as always. Thank you for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thank you, Jill.